Hi, my name is Jacob Evans, and I'm a fourth-year medical student at the University of Louisville School of Medicine. Thank you for joining us for our online compassion clinic. The topic I'm going to be discussing today is HIV and AIDS. Before I discuss, I would like to say there is a lot of reliable information about HIV and AIDS on cdc.gov/HIV. Again, that is cdc.gov/HIV. They have general information about HIV and AIDS, as well as information about HIV medications and information about HIV medications you can find within your community right on the website. During this talk, I'm going to go over multiple things that can help educate you on what HIV is, how you can get it, who's at high risk, preventative strategies to avoid getting HIV, symptoms of HIV, and what you can do if you do have HIV or AIDS. To start off, I think it's important for you to have baseline knowledge of HIV and AIDS. So, what is HIV and AIDS? HIV is a virus. It's a virus that attacks the cells in the body called B cells, commonly called white blood cells. White blood cells are important for the body because their job is to fight off infections. Without them, you can become very sick. When the HIV virus enters the body, it begins attacking white blood cells. When an individual has had HIV for a long period of time and enough white blood cells have been killed, the body is in a disease state called AIDS, or acquired immunodeficiency syndrome. With less white blood cells, the body is more susceptible to becoming sick. So in short, HIV is a virus that slowly kills cells that help fight infections in your body. When you have had the virus for a long time, your immune system gets very weak and you get very sick. Now that I've given you a brief explanation on what exactly HIV and AIDS is, I think it's important to educate you on how it is transferred from person to person. So there are different ways that it can happen, but it always involves bodily fluids. It can be transferred by blood, semen, rectal fluids, vaginal fluids, and breast milk. The two most common ways it is transferred from person to person is by having vaginal or anal sex with someone who has HIV, with anal sex having a higher rate of transfer. The second most common way of transfer is by sharing needles with someone who has HIV. Less common ways to transfer HIV from person to person is by transfer from mother to child during pregnancy, during birth, or through breastfeeding. There are individuals who are at higher risk for getting HIV, and those are men who have sex with men and IV drug users. However, many people that do not fit into those two categories can still get HIV. Many men and women that have had heterosexual relationships do become infected with HIV. Now that I've discussed how people transfer HIV, I believe it's important to talk to you about how to decrease your risk of getting HIV. So what are some ways to avoid getting HIV? The first step would be to get yourself tested and make sure you know your own HIV status and your partner's HIV status. You can wear a condom. You can be monogamous or minimize the number of partners you sleep with. And you cannot use IV drugs. And if you do use IV drugs, do not share needles and always use clean needles. For individuals who are at high risk, for example, men who have sex with men, IV drug users, or people that have intercourse with a partner that has a known HIV status of positive, there are ways to help prevent the infection. To prevent the infection, there's a medication regimen called PrEP, P-R-E-P, which stands for pre-exposure prophylaxis. The regimen is 1 pill per day. The pill is an antiviral medication. It can reduce the risk of getting HIV from sexual contact by 99%, and it can reduce the risk of getting HIV from injection drug use by 74%. You can get access to PrEP in Louisville at places like Planned Parenthood and Kentuckiana AIDS Alliance, and from most doctors. If you're at high risk, it's important to take PrEP. Now that we discussed what HIV is, how you can get it, who's at highest risk, and preventative strategies, I'm going to talk more about symptoms of HIV. After infection with HIV, many people have flu-like symptoms for 2 to 4 weeks. These symptoms include fevers, chills, night sweats, muscle aches, sore throat, fatigue, and swollen lymph nodes, rashes, and mouth ulcers. And not all of these symptoms have to appear. It can be just a few of them, or sometimes maybe even just one. So if you think you have been exposed to HIV and have any of these symptoms, it is a good idea to get tested. It's also important to get tested if you think you may have been exposed, regardless of symptoms. If you think you've been exposed, there's a medication regimen that you can take that drastically decreases your chances of becoming infected, even if you were exposed. The medication is called PEP, or PEP, or post-exposure prophylaxis. And it may be taken 1 or 2 times daily for 28 days. You can get this medication at places like Planned Parenthood, Kentucky AIDS Alliance, and from most doctors. So if you think you have been exposed, please get the antiviral medication within 72 hours of exposure. Once an individual has HIV, there are 3 stages that the virus goes through in the body. Stage 1, known as the acute infection stage, is when you become infected and it can last for several months. During this stage, individuals typically have flu-like symptoms and have a high load of the virus in their blood, and then they're highly infectious. Stage 2 is known as the chronic phase, or asymptomatic phase. This is when you have the infection, but it is not actively attacking your body. There are low virus levels within the body, and you may not have any symptoms at all. This period of the infection can last for many years, even decades. During this phase, individuals can still transmit HIV. Toward the end of this phase, the amount of the virus within the body increases and the amount of the white blood cells decreases. As the infection progresses, it moves to the next stage, which is known as AIDS, or acquired immunodeficiency syndrome. AIDS is the most severe stage of the infection. People who have AIDS have such a badly damaged immune system that they can't they do get an increased amount of infections called opportunistic infections. Opportunistic infections are infections that occur in people with weakened immune systems, such as people who have AIDS. During this stage of the disease, individuals have a very high amount of the virus within their body and are highly infectious to other people. Without treatment, people who have progressed to the AIDS stage of the HIV virus typically live on average 3 years. Well, there's no cure for HIV. There are medications for people who have HIV that can prolong life for many years. This medication regimen is called Anti-Retroviral Therapy, or ART. There are many classes of medications that help fight the HIV virus, but in general, people with HIV should be on 3 different classes of anti-retroviral medications. The medications lower the amount of HIV in the body and within the bodily fluids, and it is recommended to all people who have HIV. It can also decrease the chances of transmitting HIV to another person. And for pregnant women, it can help prevent their transfer from mom to baby. So if you do have HIV, make sure you reach out to your doctor or visit a local clinic to get prescribed ART. Also remember, you can find information on where to receive medications on cdc.gov/HIV. And that concludes my talk on HIV and AIDS. Thank you so much for joining me on this virtual online compassion clinic, and I hope this information was helpful.